My name is Ellen Barton and I am a podiatrist. As a podiatrist, my role in someone's health is focused on the foot and ankle, not only conditions that directly affect the foot and ankle such as fractures or heel pain, but also the role that whole body conditions affect it, such as diabetes and arthritis. A satisfying day at work is a good long day. I really hope that I can have a couple of people walk out of the clinic saying that they already feel better and that they're already moving a little bit quicker or moving without pain. That's my goal. I really take a team-based approach to medicine with the patient kind of as the captain or of the team. And I want to learn about what they want and where we want to go, and it's my job more to be the coach of the team. So if the captain wants us to win a championship or wants to do that, I want to help them get there. I think every healthcare system will tell you that they put the patients first. And here, I truly believe it. From everyone from the administrators to the staff in the office and the receptionists, I really truly believe they have the patient's best interests at heart with all their decisions. Foot and ankle pain can be very difficult for people to handle just because it limits your ability to be mobile and active in the community. And I really want my patients to be able to participate in everything they want to, whether that means they really want to do a morning walk or they want to get into running again. I want to help them do that. I really enjoy hiking in my free time. I love all the state parks that are here in Door County, and it's my goal to visit all the state parks in Wisconsin, but it's probably going to take a little bit of time.